Hey everybody, welcome back to Drug Talk. My name is Garrett Campbell. In today's video, we're going to be doing a more simplified version of a video that we covered in the past on Quetiapine or Seroquel. And we're starting right now. Just keep in mind that this channel is for information purposes only. So the first thing we'll discuss in this presentation is what this medication is used for. So Quetiapine treats schizophrenia, bipolar disorder, or depression. Now how to use this medication. So first, take your medication as directed. Your dose may need to change several times to find what works best for you. You need to start with a low dose, even if you've used this medication before. Your doctor may tell you to take this medication at bedtime because quetiapine can make you sleepy. Swallow the extended release tablet whole. Do not crush, break, or chew it. And what happens if you miss a dose? So take a dose as soon as you remember, but if it is almost time for your next dose, wait until then and take a regular dose. Do not take extra medication to make up for a missed dose. We'll now discuss some warnings. So tell your doctor if you are pregnant or breastfeeding, or if you have kidney disease, liver disease, breast cancer, dementia, diabetes, thyroid problems, eye or vision problems. This would include increased pressure in the eye, an enlarged prostate, trouble urinating, constipation, or a history of seizures. Tell your doctor if you have any kind of blood vessel or heart problem as well. This medication may cause depression or thoughts of suicide, so make sure family members know about this, and always tell your doctor about any behavioral changes, depression, intense feelings, or thoughts of hurting yourself or others. This medication may make you dizzy or drowsy, or may cause trouble with thinking or controlling body movements, which may lead to falls. Make sure you know how the medication affects you before driving. This medication may cause the following problems: so nerve or muscle problems, high blood sugar, cholesterol, and triglycerides, tardive dyskinesia, which is a muscle problem that becomes permanent, changes in blood pressure, eye or vision problems, heart rhythm problems, or increased risk of seizure. Do not stop using this medication suddenly. Your doctor will need to slowly decrease your dose before stopping completely. This medication may make you bleed, bruise, or get infections more easily. Take precautions to prevent illness and injury. Wash your hands often. Over the next few slides, we'll go over some side effects with this medication. The next two slides, if you experience any of these, you would just want to get in touch with your physician right away. So if you had an allergic reaction, which could present as itching or hives, swelling in your face or hands, swelling or tingling in your mouth or throat, or chest tightness or trouble breathing. If you had changes in mood or behavior, agitation, anxiety, restlessness, thoughts of hurting yourself or others, or constant muscle movement that you cannot control. If you have a fast, slow, pounding, or uneven heartbeat. Fever, sweating, confusion, or muscle stiffness. Increase in how much or how often you urinate, increased thirst, increased hunger or weakness, if you have lightheadedness, dizziness or fainting, or clumsiness, as well as seizures and vision changes. Now for these side effects here, you would just want to mention to your physician at your next appointment, or you can mention to your pharmacist the next time you pick up a prescription. So if you have constipation, vomiting, nausea or dry mouth, headache, sleepiness, trouble swallowing, or weight gain. Alright everybody, that's all we're going to talk about today with Quetiapine or Seroquel. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable, you'd like to help grow this channel, remember you can like the videos, share the videos, most importantly subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.